Thank you very much, Paul and Rachel. And I'm sorry, my opening slide has gone a bit wonky, but you get the message there. This is really I'm focusing on talking about the strategic resource that we've been working hard to develop. It's been really complicated, but absolutely fascinatingly interesting. I think we can probably all agree that we live and work in arguably some unprecedented times, and that's certainly true in the public sector. There's enormous pressures on housing, on health, and on social care, and those pressures span the volume of demand, the complexity of need, rising costs, rising expectations, and that's all coupled with significant constraints on human and financial resources. So, this strategic document that we've been working on is really about creating and articulating the argument for why we need to do things differently if we're going to make headway in some of the key policy agendas that actually transcend health, including public health, housing, and social care. Could we move on, please, Paul? Thank you. So, what I'm going to do is just give you a few of the headline acts, as it were, the really big things that have come out of the work so far. There is more there, but we've got a finite amount of time to talk about it in this session today. But I think one of the key things that drives the need for change is that by mid 2036, it's estimated that the UK population will exceed 73 million. And the number of people aged 85 or over is projected to increase from 1.6 million in 2021 to 2.6 million in 2036. That's a really significant increase. But it's also projected that by 2035, two-thirds of adults in England aged over 65 will be living with multiple health conditions. So we've got a growing population, an aging population, and more people living with complex health needs. Could we move on, please, Paul? At the same time, we have got a national housing crisis. And with an eye to this population growth and these increased life expectancies and the need to make sure that there's suitable accommodation for the ageing population and for those who are ageing with more complex health needs. It's estimated again, and this is just in England, that over 300,000 new homes are going to be required every year. Patterns are broadly similar in Wales, in Northern Ireland, and in Scotland. And in Scotland, for example, it's been estimated that 1 in 5 wheelchair user households, so that's 20% of wheelchair user households, are living with unmet housing needs. So alongside all of the issues about accessibility of housing, affordability of housing, and so on, there's some really big challenges that need to be met. We move on, please, Paul. So we know that the availability of accessible housing is always going to be a precondition for independence. If people haven't got accessible homes, they're not going to be able to do the things they need, want, and have to do. But we also know on the flip side that poor housing can accelerate declines in health and well-being, and it can drive demand for health and social care services. We'll move on again, please, Paul. So just a few startling statistics around that, really. Compared to those who are living in more spacious accommodation, children who are living in overcrowded circumstances are more likely to be stressed, anxious, and depressed. They're more likely to have poorer physical health. They're more likely to have lower levels of attainment at school, and they're at a greater risk of developing behaviours that challenge. And those who've got unmet accessible housing needs are estimated to be 4 times more likely to be unemployed or not seeking employment as a result of sickness or disability compared to those who have their accessible housing needs met, or who didn't have any accessibility needs in particular. 4 times. That's a pretty striking figure, I think. Um, and the other thing that we really need to bear in mind is that we also know that people who are more likely to be impacted by the consequences of living in non-decent or otherwise unsuitable homes are likely to be from minoritized ethnic backgrounds or to be living with serious health conditions. And that all contributes to those inequalities in health. Could we move on, please? So, just thinking about the cost of all of this, so failure to improve housing standards to mitigate those hazards in the home is estimated to cost just the NHS in England about £1.1 billion a year. Beyond that, of course, we've got the potential costs related to care for people, which in some cases might continue for an entire lifetime. More personal costs to the individual concerned includes the impact on their mental and physical health, but it also extends to other factors such as the loss of economic potential. So that might be through, for example, reduced educational achievement. It might be to do with diminished employment and career prospects, or loss of productivity in other ways. So when these factors are calculated or included in the calculations, it's estimated that the full cost to society of people living in poor housing in England is in the vicinity of £18.5 million a year. That's a heck of a lot. Okay, could we move on, please? So we've got a pretty dire situation that is going on, a very challenging situation in terms of how do we meet all of these needs. It's costing the public purse and individual human beings a heck of a lot, the situation that we're in. But as Rachel said earlier, there are a lot of opportunities in terms of shifts in policy agendas and opportunities that are current and coming on stream. Part of the challenge is that independently, housing and the health, and including public health and social care sectors, are really complicated, really complex systems in and of themselves. And each of them is shaped by really complex, multiple and intersecting policy agendas and legislative requirements. And then if we think about the points at which those really complicated sectors overlap or systems overlap, it becomes even more complicated and even busier and hard to grapple with. And then the individual contexts and the perspectives and the priorities and the approaches taken by each of the 4 UK nations adds to that complexity. So it's a really complex space in terms of the policy agendas here. But what we can see across all of that is that there are common themes, there are certain contextual features and considerations that are broadly common across all of that space. And when you focus in on that, it really highlights the extent of some of the shared interests across the housing, health and social care sectors. And I think I've just put a few of them on the slide there for you. Population health, prevention, really trying to integrate services, trying to take a higher level view of how we deliver services for the public rather than living in our little silos is a really important parts of that. Could we move on, please, Paul? And notably, Sir Michael Marmot has identified specifically that to be as effective as possible in protecting and improving public health, housing services really do need to adapt a preventative approach so that they're taking action before problems negatively impact on occupants' health and well-being. So moving upstream, not responding once we've got an issue, but trying to prevent issues before they actually take hold. We'll move on again, please. Now, this is where occupational therapy comes into it, and forgive me if I'm speaking to the preaching to the converted in some instances. I know we've got a lot of occupational therapists on the call here, but the occupational therapy profession genuinely really does provide a very unique, deep understanding of that complex interrelationship between individual people, their environments, and the activities that they need, want, and have to participate in to lead happy, healthy, fulfilling, and productive lives. We know that occupational therapists already have a very significant impact in housing, in health, and in social care. And it's their understanding of the pressures and the priorities in each of those sectors and their ability to provide that common link between them that really makes them ideally placed to support and facilitate the type of systems thinking that is going to be required to move things forward at that intersection between health, housing, and social care. We haven't and we won't solve the problems that we have by working in isolation in individual sectors. We really need to pull together to try to take a bigger view of this, to move things upstream and take that very strongly preventative population level approach rather than trying to deal with each individual as challenges occur in their lives. Could we move on, please, Paul? So, as Rachel has already illustrated in her discussion with you a little while ago, in some areas, occupational therapists are already moving beyond those more traditional roles in equipment provision and home modifications. And they're stepping into these expanded roles that Rachel was talking about that really impact positively on the broader housing arena. And they include roles that are actively contributing to and adding value to that strategic planning and resource allocation type of level of activity. There's some illustrations of the potential return on investment that I've noted on the slide there. And as Rachel said earlier, we've also identified a range of case studies from across the UK demonstrating how the introduction of these expanded and more strategic and advisory roles for occupational therapists has had a really significant and positive impact on health, housing and social care providers and their budgets, on the public purse and the national economy, on individuals, groups and communities, and on current and future generations. So it's a real long-term game we're playing here. Could we move on, please, Paul? So the strategic resource that we're developing within the Housing Without Delay package really highlights that by drawing on and optimising the impact of occupational therapists' unique expertise at this intersection of housing, health and social care offers this really potent opportunity to realise our collective ambitions related to prevention of ill health, reducing health inequalities, and supporting people to live well in their own homes and communities and to participate fully in all aspects of their lives and society. And we argue that as a key service for integrating these interrelated and interdependent sectors, occupational therapy can be the key ingredient that makes all the difference. And we argue that it should be an area for development and investment in the future. There we go. Thank you.